Helen, thank you so much for joining us. Now, how would you say Cuba has done in combating COVID-19?
Well, thank you for the invite onto your show. I would say that Cuba has been quite exemplary, actually, in its response to COVID-19, and this is based on its capacity that it has because of its incredible public healthcare service system, with the highest per capita ratio of doctors in the world, and very important has been the focus on prevention, not cure. So they have been trying to get ahead of the virus rather than just treating those who become critically ill. They set up a prevention and control plan as early as January 2020. They sent a team to China. That obviously, as you know, there's very good relationships between biotech institutes and pharmaceutical institutes, but also government to government. They started, as soon as they had the first case, 11th of March, they started door-to-door checks. So the family doctors, live among the community. They're very well known in the neighborhood. They know who's vulnerable. People who have underlying conditions are kept on a registry. And also the Cubans have been able to use some of the products of their incredible biotech industry to treat the COVID-19 patients. In particular, they have this interferon alpha-2b, which was patented and used in Cuba since 1986 and has actually been produced in China through a joint venture with a Chinese company since 2003, and that has been used to treat patients in both countries.
Helen, Cuba's managed to do this even with the US embargo in place. Now, with the pandemic combined with the embargo, how has this impacted Cuba's economy?
Well, I mean, just to be clear, the Cuban economy was already being intensely squeezed by measures taken under the Trump administration. So by early March, before the first case of COVID-19 on the island, the Trump administration had taken 191 measures to essentially to try and freeze Cuba's access to the global economy. So the way this impacts in terms of COVID-19 is with the need to lock down the country and the loss of tourism revenue, which is very important for the Cuban state. The Cubans don't have an alternative lender of last resort, so it's very difficult for them to get finances internationally. And then there's been the measures that block Cuba getting access, as you referred to medical equipment. For example, they are struggling right now to buy ventilators and respirators. There was a Swiss firm, where they used to buy their ventilators, and it's got bought out by a US linked company, and that means they can't get those machines that they need in this emergency context. Donations that have been made globally of masks and PPE and other equipment have also been obstructed because of this US blockade that's 60 years in place and has always included more or less healthcare, medical equipment and medicines. So it's been very difficult for Cuba, I think that there's a growing call internationally to end the US sanctions against Cuba, because it's quite unpardonable in this epoch when the world should be coming together to cooperate in the way that China and Cuba have been doing to combat a deadly pandemic.
All right, thank you so much for your time and insight, Helen Yaffe.